Welcome back to our channel. In today's video, we're diving deep into 12 unusual signs that could indicate liver damage. Your liver plays a critical role in filtering toxins, digesting food, and processing nutrients, which is why it's essential to take care of it. But how do you know when something's wrong? Often, liver damage can be silent for a long time, which is why recognizing these signs early is key to preventing further harm. Before we get started, it's important to note that liver damage can occur due to various factors, including excessive alcohol consumption, poor diet, and even viral infections. By understanding the subtle clues your body may give, you can take proactive steps toward better liver health. Now, let's jump into these 12 signs that could indicate your liver is in distress. Stick with us till the end because we'll also share natural remedies to help cleanse your liver and support its healing process. 1. Pale or clay-colored stool. One of the first indicators that your liver might be struggling is a change in the color of your stool. Healthy stools are typically brown, which is thanks to the bile produced by your liver. When your liver is not functioning optimally, bile production decreases or becomes impaired, leading to paler stools. If your stool becomes light or clay-colored, this could indicate that bile isn't being released properly. Additionally, your stools may become buoyant and float on the surface of the toilet water due to undigested fats. If you notice these changes, it's crucial to consult with a healthcare professional to get to the root of the issue. 2. Difficulty seeing at night, nyctalopia. Imagine walking into a dimly lit room and struggling to see anything. This is what night blindness, or nyctalopia, feels like. It might not just be a sign of aging, it could also be linked to liver damage. Here's why: your liver helps process and transport vitamin A, which is essential for good vision, especially in low light. If the liver is compromised, it can lead to a deficiency in vitamin A, causing poor night vision. If you've noticed that your eyes struggle in low light, this could be a clue that your liver isn't doing its job effectively. 3. Swelling in the right foot, peripheral edema. Have you ever noticed swelling in your legs or feet, particularly on the right side? This could be a sign of peripheral edema, a condition where fluid builds up in the lower extremities. When the liver is damaged, it often fails to produce enough albumin, a protein that helps maintain fluid balance. Without this protein, fluid can accumulate in your feet, ankles, and legs, leading to uncomfortable swelling. Swelling, particularly on the right side, should not be ignored, as it may indicate liver problems. 4. Yellow or white bumps around the eyes, xanthelasma. If you've ever noticed small, yellowish or white bumps around your eyelids, you may have observed cholesterol deposits known as xanthelasma. These deposits are a clear indicator that the liver is not processing cholesterol efficiently. When the liver is not functioning properly, it may stop breaking down cholesterol, which leads to its buildup in various areas of the body, including the eyelids. If you spot these bumps, it's essential to get your liver checked by a doctor to rule out potential liver disease. 5. Unexplained pressure or discomfort on the right side. Another odd sign of liver damage is persistent discomfort or pressure on the right side of your rib cage. After eating, if you notice discomfort or a sense of fullness on this side, it could indicate a blocked bile duct or a thickening of the bile produced by the liver. This buildup can cause pressure on your ribs and may even affect your phrenic nerve, which controls your diaphragm, leading to shoulder pain. Pay attention to these symptoms, as they may suggest liver issues that need to be addressed. 6. Red or purple bumps on the skin. If your liver is not functioning properly, it can lead to a decrease in certain proteins that are necessary for blood clotting. One of the symptoms of this dysfunction is the appearance of small, purple or red bumps on the skin, often around the legs and arms. These bumps, sometimes mistaken for bruises, are a result of capillary fragility, which is commonly associated with liver damage. If you start noticing unexplained skin spots, it's worth looking into liver health. 7. Cracked heels. Did you know that your feet can reveal a lot about your liver's condition? Cracked heels are one of those surprising signs. The liver plays a crucial role in processing nutrients, including vitamin 3, niacin, which is important for skin health. When the liver is damaged, it can use up all the stored vitamin B3 to repair itself, leaving your skin vulnerable. This deficiency can result in dry, cracked heels. If you have persistent cracks on your heels, it could be a sign of liver stress. 8. White or swollen nails. Changes in the appearance of your nails can also point to liver damage. White, pale, or swollen nails are often seen in individuals with severe liver disease. In fact, studies show that 80% of people with advanced liver cirrhosis had completely white nails. The condition is linked to impaired oxygen circulation and the liver's ability to detoxify the body. If your nails appear unusually white or swollen, consider having your liver examined. 9. Dark urine. One of the most obvious signs of liver trouble is dark-colored urine. If your urine appears darker than usual, ranging from yellow-brown to amber, it might be a sign that your liver is not processing waste as it should. When the liver is compromised, it can lead to an accumulation of bilirubin, a pigment that normally gives urine its yellow color. If bilirubin builds up in the bloodstream, it can result in darker urine. If this persists, it's time to consult with a healthcare professional. 10. Jaundice, yellowing of the skin and eyes. Jaundice is one of the most noticeable and serious signs of liver damage. It occurs when the liver is unable to process bilirubin properly, causing it to accumulate in the body. This results in a yellowish tint to the skin, eyes, and mucous membranes. Jaundice can indicate serious liver diseases like cirrhosis or hepatitis. So if you notice yellowing of your skin or eyes, get checked out immediately. 11. Spider veins, spider angiomas. Spider veins, or spider angiomas, are small, dilated blood vessels that appear on the skin in the form of a web-like network. They are often found on the face, chest, and legs and may indicate underlying liver disease. The liver's role in hormone regulation means that when the liver is damaged, estrogen levels can rise, leading to the formation of spider veins. These veins may be a sign of liver dysfunction, including cirrhosis or hepatitis. 12. Itchy skin, pruritus. Itchy skin is a common complaint for people with liver problems. The itching is caused by a buildup of bile acids under the skin due to the liver's inability to filter them out effectively. As these bile acids accumulate, they trigger an itchy reaction. If you've experienced persistent dry, itchy skin, especially without a clear cause, it could be a symptom of liver damage. What can you do to heal your liver? Now that we've explored these 12 signs of liver damage, it's time to look at how you can heal and protect your liver. While liver damage can progress through several stages, from fatty liver to cirrhosis, the good news is that the liver has an incredible ability to regenerate itself provided it's given the right care. Here are some steps you can take to support your liver. 1. Drink organic coffee with turmeric. Organic coffee contains compounds that may help reduce liver inflammation. Add turmeric to your morning coffee, as it contains curcumin, which can help reduce scar tissue and promote liver repair. 2. Hydrate properly. Drinking water helps the liver produce bile and supports detoxification. Aim for at least 1 liter of water daily to support liver function. 3. Incorporate liver cleansing herbs. Include herbs like ginger, turmeric, milk thistle, and dandelion root in your diet. These can help detoxify and support liver health. 4. Avoid inflammatory oils. Remove harmful oils like canola and corn oil from your diet, replacing them with healthier fats like olive oil, coconut oil, and butter. 5. Eat sulfur-rich foods. Sulfur helps detoxify the liver. Include garlic, onions, broccoli, and leafy greens in your meals to support liver function. 6. Try intermittent fasting. Giving your liver time to rest can help reduce fat buildup and inflammation. Intermittent fasting can stimulate liver detoxification and promote healing. By recognizing these early warning signs and making lifestyle changes, you can help protect and even reverse liver damage. Don't wait until it's too late. Your liver needs you to take action now. If you found this video helpful, make sure to subscribe and hit the bell icon so you don't miss any of our future health tips and wellness videos. Thanks for watching, and take care of your liver. It's your body's detox center.